What to expect at your first clinic visit with an adult hematologist. Before your first appointment with your new adult hematologist, be sure you know your medical history, what medications you take and why you take them, as well as what complications you have had or currently have from sickle cell. Before your appointment, write down a list of questions to ask your new hematologist. This will help you make sure you get all the information you need during your appointment. Also, don't forget to bring your insurance card with you to your first appointment. At your adult hematology appointments, you'll be responsible for answering questions about your own health and your sickle cell disease. This is why it's so important you know your medical history. You'll also need to schedule your own appointments with your adult hematologist. And before you leave your appointment, make sure you know how to make your next appointment and how often you need to see them. You may be wondering why your parents can't help you answer these questions or make your appointments for you anymore. That's because at 18, you're a legal adult. This means that your parents are not able to see your medical records or talk to your doctors without your permission. It is important that you are independent and responsible when it comes to your own health. So to recap, before you leave your first appointment with your new provider, make sure you know the following things. Number 1, who to call if you have pain or other sickle cell symptoms. Number 2, who to call if you need a prescription filled. Number 3, how and when to make your next appointment. And number 4, where to go in case of a medical emergency. Now let's see an example of what a first appointment with an adult provider is like.
Hi Damon, I'm Lindsay, one of the hematologists here at the adult clinic. How are you doing?
I'm okay, how are you?
Good, thank you. So I understand you're transitioning from the Children's Sickle Cell Center to the adult world?
Yes.
Good, well welcome to adult hematology. How has everything been going?
Pretty good.
Good. Just going to ask you a few questions about your sickle cell disease. Do you know what type of sickle cell you have?
Yes, I have sickle cell SS.
Okay, and do you know what your baseline hemoglobin typically is?
Baseline is usually 8 to 10.
Okay. Do you take any medications at home?
Yes, hydroxyurea as well as a few pain meds.
Okay. And what dose of hydroxyurea are you on?
500 milligrams.
Okay, and do you know for how long you've been taking it?
About 5 years now.
Okay, good. Do you feel like it's made an impact on your disease?
Yes.
Okay. And any allergies to any medications?
No.
Okay. So tell me a little about your pain crises. Where do you usually get your sickle cell pain?
Usually in the chest or lower back and sometimes the head.
Okay. And how often do you usually have sickle cell pain?
Usually every day.
Okay. What would you say is your average pain level on a scale of 1 to 10, 10 being the worst pain ever?
Baseline is usually a 3 to 4.
Okay. And at what point would you say you usually have to go to the hospital or emergency room?
I'll go to the emergency room if it rises above a 7.
Okay. What do you usually do at home when you have pain?
Take my pain meds, drink a lot of fluids, and even exercise has helped.
Okay. And if you have to be in the hospital or emergency room, what medication do they usually give you there?
They usually give me morphine through the IV.
Okay. And how many times do you think you're in the hospital or emergency room on an average yearly basis?
Usually 1 to 2 times a year.
Okay. And have you had any other complications from your sickle cell disease, like acute chest syndrome, strokes?
I've had acute chest before.
Okay. How long ago?
About a year ago.
Okay. Have you ever had to have a blood transfusion for your sickle cell disease?
Yes.
When was the last time?
About a year ago.
And prior to that, did you have to be transfused?
Yes, I did.
Usually for crises or during hospitalizations?
Yeah, usually during the crises.
Okay. And then just a few questions about things we call health maintenance. Are you up to date with your vaccines, like your pneumovax and flu vaccine?
Yes.
Okay. And what about, have you had an eye exam in the past year?
Yes, about 6 months ago.
Okay. And what about an ultrasound of the heart?
Ultrasound was about 4 months ago.
Okay. And do you have a primary care doctor that you see in the community?
Yes.
At this point, your appointment will also include a physical exam. Your new adult hematologist will provide instructions for any medications, labs, and follow-up appointments based on your physical exam and your medical history.
Okay, excellent. Do you have any other questions for me today?
Okay. Now that I'm transitioning, do I come to see you guys when I'm having pain?
Yep, so now that you've transitioned to the adult world, when you have a pain crisis, you can call us with any questions, and similarly, you would come to the adult emergency room if you have crises now, and they can contact your adult hematologist.
Okay. And do I also fill my prescriptions with you as well?
Yep, so for your pain medications and any medicines relating to your sickle cell disease, you can call us.
And I know I have one more appointment with the children's program. When should I come back?
So you'll see them one more time just to reestablish, and then you'll see us in about 2 to 3 months for follow-up.
Okay.
And to schedule that appointment, you'll go out to the front desk, and with one of the patient service representatives, they'll help you get scheduled for your next visit.
Cool, thank you.
All right, nice to meet you.
Nice to meet you too.
Damon just needs to make his next appointment, and he's all done with his first adult hematology appointment. Your first appointment will be similar to this, and may also include getting your labs drawn and a physical exam. And just like Damon, before you go, make sure you know who to call if you have pain, need a prescription filled, or need to make an appointment. Make sure you also know where to go for adult emergency care.
The biggest challenge was definitely getting to know new doctors. Biggest fear was, not getting the same care that I got here at Lurie's. A few positive things that you can look forward to is more freedom, a little bit more responsibility. Sounds bad, but it's actually great, The advice I would give is be open, ask a few general questions. It's very easy, and be comfortable. The program here at Lurie Children's actually helped me really well. I was very comfortable at my new doctor, and they made it really easy.
I felt my biggest challenge was getting to know new doctors. The advice I would give to other parents whose kids are transitioning to adult care would be just to ask the doctors all the questions you need to know. Make sure you're very comfortable with them and your child is comfortable. The program here at Lurie's helped out tremendously. Everyone came on board, answered all our questions, walked us through everything. It was a very smooth transition.
We hope that you found this video helpful and that you're feeling better prepared for your first clinic visit with an adult hematologist. From all of us at the Comprehensive Sickle Cell Program at Lurie Children's, we hope to make your transition a great one.